I'm being told that it is one of the oldest hospitals, maternity. Over 500 beds or 500 mothers are assisted at the polyclinic. The tragedy is that the place has grown indeed, but in itself it has not grown. What is tragic is that there are two houses. There's Pagent house here, there's Carter house here, that are owned by the city. We are not getting any rentals from those places. Yet we have crammed the useful work here. Our estate managers and our departments that are in charge of this building are really doing a disservice to this community. What we need is that the health department must immediately make an application to use Carter House as an extension of the maternity clinic, or to use Pagent House as an extension of the maternity clinic. These will make very good and big hospitals. We need to then put theater capacities. I see there is only one delivery bed or two. There are only four delivery bed and one delivery room. So it is a tragedy. We need a one city approach. The left hand must know what the right hand is doing. This useful activity is cramped in a historic place, yet we have these buildings where people are coming to me every day wanting to list them for all sorts of selfish reasons and for them to make their money, while the city's critical operations. I'm being told mothers come from all over the country to come and deliver here. People who are sick come to deliver here. 500 beds per month is not a joke. And as a city, we must complement, and I've always said this, that our senior executives and other people must resist the temptation for self-enrichment, the temptation to corruption. It is very easy when you are intelligent to steal from the people. It is very easy to do a disservice to the people. It is harder to think about everybody else except yourself. Why would this clinic be cramped in this place when there are two empty buildings that are owned by the city that we are not getting rentals from? Why? I want to have answers. Dr. Mr. Chigeru is one of the administrators here, and Dr. Bara. Let's look into this. This is a sheer waste of assets. Yeah, it's a sheer waste of assets. Why would we be putting people in a place that looks prehistoric, that clearly is being cramped? People are not getting a service. Well, it's these two buildings that have nothing and no one in it. Why can't we refurbish them? Put maternity wards in them, make them into state-of-the-art hospitals, renew Mbare, make sure that we begin the urban renewal of Mbare, a strategically located place, and if we start investing in those areas, I don't see any reason why these two houses are not being used for the purposes of treating and expanding this clinic. So find a good reason and find me a person who will resist that, and then we will get rid of them from our city council, because we cannot have such blatant selfishness, reckless thoughtlessness that is being exhibited in this place, and sheer lack of imagination in the use of our assets and sweating our asset capital. We need this for the people, the mothers I'm seeing here. The good work that is being done by the matrons here must be complicated by strategic thinking by our management and the executives. So what is happening here is clearly not strategic thinking at all. The highest level of incompetence, highest level of thoughtlessness, and highest level of cruelty. So I need a report to the relevant committees by next week and I'm going to want to declare it when I hold the next council meeting that is coming up next week. We need to make this into a hospital and not the uses, so that mothers and everybody else can have a modern, a bigger space to have babies and to be treated. And now you're trying to cramp a pharmacy there when we have all these buildings. Who is in there? What is happening in there? Nothing. So that's what we need to do, and that must be done as a matter of urgency. Unless someone comes up with a better reason to use those buildings than the reason I have said. And normally very few people think better than I do. If they do that, we will see and we will use it for